before we started our agenda, I will write some activities today, such as opening, and then the second is reciting Holy Quran. The third is sing a song Indonesia Raya and also Sang Surya. And the fourth is greetings. The fifth is about the presentation for the material forensic psychiatric nursing. And the sixth is question and answer. And the last is closing. Okay, for the opening, let us we saying basmalah together to open our forum. Bismillahirrahmanirrahim. Baik, kita sudah membaca basmalah. Alhamdulillah, kita akan lanjutkan untuk kegiatan selanjutnya. Okay, the session is about the reciting Holy Quran. It will be presented by Mr. Afif Suprofi. For Mr. Afif, the time is yours.
Menteri Keuangan itu sudah berhasil menunjuk. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Alhamdulillahilladzi anzala ala 'abdihil kitaba wa lam yaj'al lahu 'iwaja qayyiman liyunzira ba'san syadidan min ladunhu ويبشر المؤمنين الذين يعملون الصالحات أن لهم أجرا حسنا ماكثين فيه أبدا وينذر الذين قالوا اتخذ الله ولدا ما لهم به من علم ولا لآبائهم كبرت كلمة تخرج من أفواههم إن يقولون إلا كذبا فلعلك باخع نفسك على آياتهم إذ أوى الفتية إلى الكهف فقالوا ربنا آتنا من لدنك رحمة وهيئ لنا من أمرنا رشدا صدق الله العظيم. Assalamualaikum warahmatullahi wabarakatuh.
For Mr. Afif Suprofi, thank you so much. Okay, now we continue to our session. The third session is about sing a song Indonesia Raya and also Sang Surya. Please, all of the participants are asked to stand up and sing it together. Indonesia.
Kesuwen. Kanggo napa Pak piye? Kanggo nake. Nomor yang anu apa nene?
Kate aku mulai wan anu lekas.
Okay, for the participant have a seat, please.
Mic-nya belum dibuka.
For Mr. Syahrul Ramdhani, the time is yours.
Yeah. Assalamualaikum warahmatullahi. Our business guest from Hanze University of Applied Science Groningen and Hyllan, and all of the lecturers and session or instructor for all of the home-based hospital. First, Allah SWT, the most beneficent, the most merciful, and salawat, salam to our Prophet Muhammad Sallallahu Alaihi Wasallam. Amin ya Rabbal Alamin. First of all, I would like to say welcome to our School of Nursing, and thank you very much for being here, the speaker for our forum, or Hyllan and also Sena, and I think it's the great opportunity for us to learn more for our partner and this kind of our application and one application and of our own MOU. Yes, yesterday we signed and then today we have already implementation. I think that's good, good MOU, because MOU not only we sign and then save in our RC, but the implementation is very important. So thank you very much and welcome to our School of Nursing. We hope you enjoy in our university. And the secondly, I would like to express my interest for forensic psychiatric nursing. When we see what the expertise from the Hyllan and also the Sena about the forensic psychiatric nursing, it's very interesting for us, especially for me, or I think for all of the lectures also, because it's not too common in Indonesia. We call the forensic nursing. And I just know from your slide, it's kind of the psychiatric nursing. So here we have Dr. Santi. She's the head of nurse, the last period, and then her expertise in the psychiatric nursing. So I just said to her, it's kind of forensic psychiatric nursing. It's very interesting for us to know more about it. And then maybe this thema and also for our preceptor in the hospital, some of them they are working on the shift, so while they are taking care of the patient, they here for the yeah, some of them join with our scientific forum. And also some of lectures they are in community now. We hope that they are joined, because we are actually in I mean in the day that we every day have a lecture in the campus and also in the hospital and in the community. But we hope that they will finish and join us in this afternoon session. Yeah, and we appreciate also for all of the lectures and then preceptor and clinical instructor to join us. We hope that this thema can improve the knowledge about the forensic psychiatric nursing, and then maybe we can implement and conduct it with our curriculum also about the forensic psychiatric nursing. Maybe next Santi will share also what we learned in psychiatric nursing in Indonesia, and then this part already include or this in other department. Just say here Pak Afif, the expertise in the emergency nursing. So if we talk about the forensic, I guess it's connected with the emergency nursing, but maybe it's not only emergency or the critical care, but yeah, here in psychiatric nursing. So yeah, I'm ready to know about the knowledge and also the topic about forensic psychiatric nursing. And the last one, I want to say this is good opportunity, and also we hope that the program is not only stop here, but we already thought yesterday we will have some agenda, and then we do this agenda blended because we hope that preceptor can include also in our activities, not only lectures, because basically the program only for lectures, but we want to improve the knowledge and also the update of the nursing science for our preceptor. Although, yeah, we are still learning also for that. That's very teacher. But I think all of the pastor are really have interest for improve their skill and also their knowledge. Yeah, I think that's all for me. Thank you very much, Alan, and also Sana. We hope that this is just the beginning, and then we have the brightly future cooperation. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. For Mr. Syahrul Ramdhani, MSc, MNS, thank you for your greetings. Now we will continue our agenda. This is, as mentioned by Mr. Syahrul Ramdhani, that forensic psychiatric nursing is new, for us, especially I never heard before. But now today, Hyllan, Weijer, Master of Education, RN, and also Sen will be present about the forensic nursing to us, and after that we can continue to the answer and discussion. I mean that the question and answer. Okay, now it's time is yours.
Thank you, Hyllan, for your kind words. Thank you for your kind introduction. And it is a great honor for somebody to stand here to do this guest lecture, which is a good opportunity to get to know each other, get to know the issue we are dealing with. And one of the issues is the forensic mental health care. So in your introduction, what you mentioned already something about this. Maybe you know that we are both registered nurses, and I still work in the forensic mental health care every week. My experience of the days. So what do we, what the agenda is about the definition of the forensic psychiatry, the aim, where you do it, what are the tasks of the nurses, especially in forensic psychiatric nursing, and the last two issues I think we
Well, Hyllan, yeah. Maybe you can just start with your experience, maybe in the clinic.
I will start with it. So about the definition of forensic psychiatric nursing. So how we train students in our curriculum is another important issue, because our students get to know these people. We have to compare them for this target group, and we end, of course, with questions and hopefully a discussion about the issue. Now, first, the definition. What exactly is forensic psychiatry? It is aimed at people with a mental or psychiatric disorder who have committed a criminal offense, and for whom there is a high risk that they will commit a criminal offense again. In that case, a judge can impose treatment. So, in fact, it is where it starts, all where mental health care and justice meet each other. So it is about so the people who have committed a criminal offense while they were under the influence of a mental health disorder. That's the target. And first, the mental health disorder has to be diagnosed, of course. So the first one is taken to prison, and we have a special center to examine people if there is a mental disorder. If not, they go to jail. If it is, they also go to jail. They also, oh yeah, oh, that's a good difference. That's better. Okay. Thank you. So to repeat it, not all. So we have a special center in the Netherlands to examine those people if there is a mental health disorder. If not, they go to jail. If there is a mental health disorder, they can be taken into a special forensic institution where they get their treatment. So the goal of forensic care is to prevent recidivism. In other words, the aim is to reduce the chance that someone will commit a criminal offense again, of course. So we treat them, we guide them so that they can function in society again, which can last many years before they get into society again. And forensic care is aimed at increasing public safety. That might be the most important issue to do this kind of care, to increase the public safety. Yes. So just the phases of treatment. There are 6 different phases. Not every patient goes through all these phases. So the order may also differ per patient. But we always try to be very personal in what we do. So what one person needs doesn't have to be what another person needs. So there's a preclinical phase, which every patient has the penitentiary institution. Then, when he's examined and a mental health care disorder is diagnosed, and someone gets to the second phase, which is the entry phase in the forensic institution. We will show a video about, well, just to give you a view of how it looks like. So in this entry phase, which is a very important phase because we want to know the trend of the behavior that has led to the offense. What was happening with someone before he committed the crime? Was the person psychotic, maybe? Or was he very stressed or whatever? So the mechanism of what behavior has led to this crime is very important because that's the starting point of the treatment. Then the flow phase with an intensive treatment and reducing the risk on recidivity. This can be a long-lasting phase because a lot of people suffer from, well, let's say, what is een terugvalzone? Well, falling back into old behavior, let's say it like this. So you can always see the tops and the downs in their behavior. Because of course they are very much confronted with their own behavior, and we always try to make them aware of their own behavior, which is just in a group. So they live in groups in the forensic institution. They are most time they are divided according to their mental health disorder. So we have like a psychotic ward, we have a ward for personality disorders, we have a ward for psychotic people or for people who are in a kind of a crisis or in a bad condition. So it's divided into different wards, and they get very much confronted with their own behavior. So that's what the nurses do. That's what the nurses do. Let them reflect on their own behavior. Just say what you see as a person, as a nurse. When someone's aggressive to you, just tell them. So what you do now isn't correct. Sometimes it leads to more aggression, but okay. But the trend is the line that we want to hold is make people aware of their own behavior, because that is very much the behavior that has led to the offense. So we get to deal with it every day, which of course is very difficult when people are psychotic. So you have to first to give them medicaments, or not just to control the psychotic state, to get them treated well. And there's another problem in this flow phase, well, in fact, in every phase, which is drug abuse. I think that about 90% of these people use drugs, more or less. And using drugs is, in my experience, is very, very bad for the treatment. It is very undermining. There's another word for it. It's subversive. That's right, subversive for the treatment. Because the drug abuse makes them more aggressive, or maybe the other way is that they are very well sleepy and well, just want to sleep the whole day, like sedated, in fact. So that's a hard position for the nurse to make them aware of their own behavior. So that's difficult. So drug abuse is a big problem in all these phases, in fact. So as I said, they live in groups. They live in groups together. These groups are about the size of, I think, 10 or 12 persons, mostly men. So mostly men are the target group. And we try to make them function better in a group. So make them kind of socialize in a group, which is very positive for them to change their behavior. Okay, I'll come back to this flow phase. The outflow phase, they are prepared for the life after the treatment. So the life after treatment will be independently living, assisted independent living, or assisted living. And after that, of course, there's a phase of outplacement, which could be as well a long stay. We have to accept that there are patients who will never change their behavior and will always be a risk for the society for recidivism. And these guys are going to the long stay. Yes. And in every phase, of course, thank you, Sandra, the nurse can play an important role. So in fact, we are the eyes and the ears of the psychiatrist. So we have a very different role in observing, making contact with the patients, what happens in that contact, and what does that do for security and recidivism. Okay, a small impression of an institution. This is in the south of the Netherlands. This is the Woensel Support, we call it. It's a forensic mental health institution. I don't know if the people online can see it. I hope so. So there's a lot of safety measures, as you can see, with all the gates. People just can't get out or get in. And as getting out, we build it up. Yeah. Build it up again. And freedom will be built up again. So if you think they can do sport, they have to work as well. They have to work, they are forced to work. If they do not go working, there will be, there goes a signal to the resocialization. And when they tend to never work, there could be a measure. I'll come back to that point. So it looks, I think, it's very beautiful.
Yeah,
Yes.
it's very beautiful.
Very beautiful. Yes, yes, this is a forensic mental health institution. Yeah. Yes. Yes. And she shows there's some rooms in the institution.
Oh yeah. Opname is opness. This is stays. Stay.
Means admission.
Yes, admission. Yes, same in Indonesia we use because it comes from admission. Language, yeah. Opname.
So there's an office for the nurses.
Hmm.
It's always the same. There's an office, and an office from where you can see all the patients.
Oh, yeah.
They eat together, they live together. Sometimes they cook. But then I come to another point, which is the fear of taking your cutlery with you to your room, knives, etc. Ik denk dat hij op de spot mag, maar ik denk dat hij verder. Ja. Well, it looks all cleaned up and structured, but I think that might be because of the movie. I've never seen it like this. Yeah, it's beautiful. Yeah, most of the time it's messy. The rooms are all messy because these people are not structured in their heads, so their rooms are always. No, this is in the south of the Netherlands, near Eindhoven. Yes.
Ini ke apartemen.
Most times they have their own shower, their own toilet. No, it's not private. No, it's national.
Okay.
There's a whole national. Okay, I think that's enough for me. So these are the most seen disorders in the forensic mental health care: psychotic disorders, sexual disorders, and the personality disorders from the cluster A, B, and C. So like cluster B is the borderline, the antisocial, narcissistic disorder. And most of these in the target group are men. Most of them suffer from the antisocial and narcissistic personality disorder. Yeah. So what does a forensic psychiatric nurse do? So I already mentioned some things. What I didn't work out is the issue of safety, working safe. So like you have to be, as we call it, forensic alert, something like that, forensic alert. We say forensic scherpte, forensic sharpness. So always you have to be aware of where do I stand. Is someone able to attack me? Does someone had a knife? So we always, after we have done breakfast, lunch, or dinner, we always lock and we count the cutlery. So it can't be so. The situation can't be so that someone takes a knife to his room or something like that. So we always count it, and when it's not okay, people don't get out. So that's a very important thing. The safety for our students as well. So there are big accidents sometimes. So they yes they do, but not in the second year, and only in the third or fourth year of their bachelor. So so you have to send students there who are able to to just be verbal and non-verbal, strong, and can deal with this target group. Especially, you can imagine young female students having to deal with this target group is very confronting. Yeah, so they can be very provoking, and that's you have to learn to deal with that and not take it personally. I think that's one of the most important things. Don't take personal what people say to you. If you're going to take it personal, you better stop it. So yeah, very bad for your own ego if you take it personal. Yeah. So, but the fact of and ensuring safety. So like I can mention that in November we had a big incident in the place I work. That one of the patients took a knife from the office of the nurses. That's where the bigger knives are locked up, but he could grab one and stab three people, and one of the colleagues died, and two were hurt very seriously. So, and sometimes these things happen. It makes us aware of the issue of safety is 24/7 important always. And you see that after such an incident, the rules are more strict, and people tend to have more focus on safety. But after a while, you see it calming down, and that's always an important issue. Right, contact. So getting in contact with the patient to make a good observation and a good report of how one feels, how one does, how one behaves. Analyzing the situation, which demands a lot of knowledge about mental health care, about behavior. Of course, coordination of care. So, of course, having a discussion with a psychiatrist about behavior, about medicaments, about whatever. Create and handle a therapeutic living environment. So you have to create an environment in which a group can function optimally. So if there is any aggression between or stress between people, you have to mention that, and it will be discussed in the group. It has to be, because if not, it goes on, like we say, under the skin. Things go on, stress goes on. And with such a target group, the stress could come to an outburst in aggression, especially. So it's always keeping your eyes and ears very much open to observe what people do. And not only what they say, but people are very trained in, like giving each other drugs, like when the visitors come, they take drugs into the institution. So the therapeutic living environment, because if there is not a good living environment, the treatment doesn't work. It just doesn't work. So you have to not give them the opportunity to use drugs or be aggressive to each other or have a lot of stress. You can, it's good to speak it out, to discuss it in the group. Okay, I think that's most things I have said something about.
Ya, Boh.
Ini askan yang kemarin ini udah saya ganti yang di bagian DO DS-nya.
Yeah, I think the work of the nurse is limited when it comes to the therapy, the team therapy. So of course you have you speak often to these people, but when it comes to real therapy, most times there are specialists who do the therapy, like music therapy or psychotherapy therapy, yes, or behavior therapy. What a nurse does is for example, courses with the patients, courses in dealing with drug abuse, or how can I handle my call it, my urge to use drugs. How can I deal with that? Because drug abuse is a big problem. So that's what nurses do. We have some modules about that, or modules in maintaining your finances, or how simple things. How do I make my room clean, or these kinds of things. Because some of these guys have always been in a criminal environment and haven't had the chance, or didn't have the initiative to learn the normal things. The challenges for us as a nurse. But maybe some of you want to add something about this? About what we just know? Okay. Okay. Dealing with aggression, dealing with addiction, dealing with an acute crisis, dealing with the inability to function in a group, or dealing with unsafe situations. I think that dealing with aggression, yeah, that is 24/7. Aggression is one of the most dangerous, one of the most important topics in forensic mental health care, especially when it comes to men. So, what we learn is to de-escalate when we observe patients well. We already have some signs of increasing stress or upcoming aggression, and then you have to intervene. And when you let it go, and it comes to an outburst, well, you could say that it is your own fault. You made a mistake, you let something go, which you didn't have to let go. So there's a lot of aggression varying from little outbursts to really big fights between people. When there's something going on, when aggression is there, you press your button, and when you're in a position with a patient that is aggressive, I press my button, and then a lot of people come to me to help me, to assist me in getting this person to his room or to a isolation room or whatever. Yeah. Okay. Even kijken of er iets. Dealing with addiction. Okay, it's something I already mentioned. Well, dealing with addiction, when a person has used drugs, which we can control with a urine check, there will be a penalty, like not going out until the next urine control is over. Could be that someone has to stay inside for maybe a whole week. Could be. Right. So how do we train our students? That might be a good thing to focus on. What we learned then in the second year of the bachelor nursing is motivational interviewing and de-escalating interventions. And in a situation of aggression, you could combine this. But especially the last topic, de-escalating interventions, is very much needed for students who go in a forensic mental health care institution. They have to know what to do when someone gets aggressive, which can have very different forms. It doesn't have to be physical aggression. It can also be verbal aggression, or just someone who is provoking you just by walking towards you, just provoking, hey, what do you want? This is aggression. This is aggression. With students, when we exercise this with students, and for example, I exercise this or more intimidating, then I ask them, is this aggression? They say, no, well, no, we don't think so. I said, this is aggressive, really. So it's the awareness of what is aggression is important for them. What we learned then is is like maintaining the distance, at least length of the arm. Keep your distance. So when I'm very aggressive, I walk to Sana with a very provoking attitude, you have to keep her distance. Like this. You can discuss if the hand has to be like this or like this. But this is more like a police officer. Yeah. It could provoke a patient. So we learn that to do like this. Keep your distance.
It really matter how you stand somewhere. If I stand like this somewhere, the patient will probably think, oh, I can handle that nerves. But if I stand with a kind of security, with both legs strong on the ground, and I
Present yourself.
Then the power to actually make sure that my interventions look like I mean it. That's what we also teach them in these lessons, like use your body language to show some kind of power.
And of course, no topic in sexual intimidation. It's the exercise in the lessons. So like nice you're here again. It's shift. Can we talk to me? If I ask my students if this is aggression, they say no, it's not. I say, why not? Well, because you're kind. I say, no, I'm not. I just do this because I have an underlying intention. Manipulating or just
manipulating,
pleasing or whatever. So it's to recognize that it's very important for the students. Yeah. So we don't train the physical aspects, so defending yourself is not in the program. It's fitting, but it doesn't sound like that. So this is in fact the limit. So walking towards someone, keeping distance, that's in fact the limit of what we do. There's no physical training. But we learn then, like Sana said, use your voice. Stand there, feet on the ground. And I know it because recently I had a conflict with a patient, and he was very angry at me. He came walking, and I always learn my students, keep your distance. But I let this man, I thought I'm not gonna go away. So he came towards me, standing me almost nose to nose. But I said, I thought you're not gonna win this. But it is. Well, it's your intuition makes you act. So after the scene, I was a little. I thought, well, did I do well? Did I act well? But my colleague said, well, you did very well. It was very okay. But then what I meant to say is, then you feel the stress in your body, you feel the adrenaline, you know, and that's what you cannot do in your lessons. You know, but okay, you can try to come to that point. So we do a lot of acting in our lessons, simulations, yeah. And our final assessment is with an actor that the students don't know. And there's we have a kind of a scenario, and they get a scenario. The actor is going to do something. They have to react on it. And it could contain all kinds of aggression, like the more pleasing or the more really tending to physical, yeah. So then we use these kind of models, the Rosen theory, like you know, it's the transactional analysis, to, of course, meta communication.
We know. Yeah.
Yeah, this is really close. Very good model to analyze the situation, to analyze behavior and communication. Great.
Maybe it's not familiar. And we can explain something about it.
Yeah.
It's a model for communication and cooperation. And we always say to students that above is dominant behavior, and dominant behavior always leads to below defensive behavior, which can lead to aggression again. Yes. And we want the students, we want them to get into this mode from leading, helping, cooperative. So we use a model of so the phases of green, yellow, orange, and red. In the phase of yellow,
Like create.
it's the same. It's quite the same. It's quite the same. Yeah, quite towards de-escalating. And red is when someone's really aggressive to you. You only can do a thing. You can express your button. But in the phase of yellow, for example, you can ask someone, "What's the matter with you? I don't know you like this. Can I help you?" So you get to this phase. And what we always learning students is they have to move a little with someone. You cannot just.
Yeah. And KOG, what is
Opposite.
Opposite together. Opposite together. Yes.
together?
Yes.
Opposite.
So what we want to do is that make students aware of their assertivity. They have to be assertive and leading and helping. And what can it do for you? Or no, I can't tolerate this behavior, so you better have now a time out, go to your room. Be very clear and strict. So, and that makes you have to use your voice very clear and strong. Your physical, your body language is very important. And like some already said, well, if you stand there like shy or fear, well, it doesn't impress one. So you have to learn that. Yeah. But the first thing is, what happens with you? What feeling do you get if aggression against you is shown? What do you feel inside? Be aware of that. Okay. But I know some colleagues in the French healthcare who are very young, and because of their lack of experience, they tend to dominant behavior, and you can see directly that the patients don't accept it. Who are you to tell me what to do? You, young girl. Me, with my experience, with my bad youth, with all I've done. you know, so they don't accept it. So that's a very bad attitude to start your nursing career with. So they have to learn to, oh, don't do that. Accept these people with all they have done. Okay. Next slide is about. Okay, there's a transactional analysis. Okay. Well, one of our models, it are all models to declare. Well, you know this, yes. It's very common, I think, the rose theory and this one. And of course, meta communication. So what is happening? Sometimes you can get into a discussion with a patient, and there's no solution. It's only getting worse and worse. So then it is a good intervention to say, well, let's just see what happens now. What is happening? You are holding to your point of view. I'm holding to my point of view. There's no solution. So what could we do now? What's the best thing to do? And that works very well. It reduces the stress, you know. But not every patient is willing to do this. Just wants to make his point, and in fact, he wants you to say, you're right. And sometimes that works. Okay, you're right. You're right. Just to de-escalate. This is the last one. Okay. Maybe something to add. Yeah. You have something to add, someone? Because your friend is in the, your husband is in the mental health care as well.
Yes, using microphone, please.
Only thing I would like to add is that this field is getting, unfortunately, bigger and bigger in the Netherlands. It also means we need more nurses with this specific expertise, and that's kind of a challenging thing actually, because you can imagine that especially when students are young, they feel quite scared sometimes to work in this field.
Yes.
So I think you, at least you, but then other lecturers as well in our university that really try to empower students, although they are very young and although they are maybe not have that experience yet, try to empower them to find out why this field is so interesting.
Yeah.
Because it can be actually a very interesting scene for also young nurses, I think. And yeah, we see that as a kind of a goal for the next years, I think, because we know that the amount of patients in this field will grow. Due to all kinds of factors, like yeah, it can be anything. Yeah. So that's one of the challenges we face in our university right now. To not only because I'm not sure if it's the same in your university, but most of our students wants to work in the intensive care unit or in pediatric unit.
Oh.
Yeah, that's what they all like, or in emergency or ambulance like that. That's where like 80% of the students wants to go after they've graduated. But the upcoming amount of patients in mental health care, psychiatric care, and forensic mental health care is so big that we have to make sure that also students go to this field.
Yeah.
And that's quite challenging, I think. Yeah. But we get really good feedback from our students on the de-escalating interventions,
if we tell students about our experiences in the schools, then they get enthusiastic for it. So that's a good thing, I think. Yeah.
Okay. Okay. Yeah. Thank you, Helen and Sunny, for the nice presentation. And this is very informative because, yes, I already mentioned that this is very new for us. And as we see that about your video, is a very beautiful building for the forensic institution. And yeah, we never imagined before. And yeah, many participants said that it's very good, clean, and yeah, it's very beautiful building. It's different, quite different in here. But we don't have a, kita nggak ada ya, Bu, forensic. We don't have a forensic institution, but only mental hospital. Okay.
And we find out that in the Netherlands about 72 of these
72
institutions.
Oh, wow, 72 institutions.
Very
Because we only have 70 million
70
inhabitants in the Netherlands.
70 million.
That's only, yeah. A lot of institutions with this
Yeah.
patient.
Okay. Okay. Now, this is the question and answer sessions. Maybe you can sit down here, just relaxing. And now, Miss Santi, PhD, she is a psychiatric nurse and have a specialty or expertise in the psychiatry. Maybe you have a question or yes, some explanation. Sana. Santi.
Yeah, said I working in this university. I also working in the UMY hospital in the psychiatric polyclinic unit and outpatient, and also yeah. After actually for me, forensic psychiatric nurses is not like a new for me. Because I also am working in the psychiatric nurse, and actually in our program we have master program. We have the psychiatric interest there, and we also teach about give the student material or topic, just one topic, just one meeting about psychiatric, forensic psychiatric nursing. So, but yeah, actually in our country, we don't have yet the psychiatric, forensic psychiatric nursing
Institution.
Especially for psychiatric, forensic psychiatric nursing. But the hospital, I mean, a forensic psychiatric hospital. But I know about this kind of hospital when I watch the movie, the Hannibal lecture.
Oh, yeah.
Yeah, it's located in Baltimore. So and also other movie, because I like to watch movie, especially about like criminal and so on. So I can image the location, but it's very beautiful in your hospital, and I willing to go to your hospital because so interesting. And for your information, why our country is having the hospital for forensic psychiatric, because our mental health law just established in 1914. Just yeah, a few years ago, just for few years ago. So the regulation and also policy, we still struggling for to develop the system. So now we do the screening for this is the criminal do by the patient with the psychiatric condition in the mental hospital for general mental hospital, and we have them including it's generally we do in the PICU, psychiatric intensive care unit, and we to make sure that the patient could do some criminal, do some criminal is really have the mental illness or because of the like a pretend to be mental illness. We do in the psychiatric intensive unit. Yeah, sometimes because this is the bad effect of the psychiatric, the mental health law in Indonesia. Because now the good news is many people aware about mental health, and we know the symptom of mental health, and someone who want to do some criminal act, they pretend to be like because of the hallucination. I do that because of yeah. So that's why the policeman sometimes send the patient, the criminal, the person to go to mental hospital, and then we do autopsy, and then they will be on PICU on maybe 10 days to make sure that is that because of mental illness or not, something like that. Yeah, this is the condition in Indonesia now. Yeah, I imagine in Indonesia will soon have the psychiatric forensic psychiatric hospital. So that's why, because in one of the fairs of mental health law, it's also mentioned about the person who do some criminal with mental illness. We already mentioned in our law, so maybe with the government soon will develop some system to do like that. My question is, for your hospital, is there any special requirement to be a nurse in the forensic psychiatric hospital? Like she or he has to have the martial skill, something like that, to defend mechanism, yeah, or it's a priority for men, something like that, or
With the bigger body, maybe.
There are no special requirements, because any student after his graduation can work in the forensic mental health care. But yes, but of course you get some discussions with the when you apply for the job, and of course they will ask you several things about how do you react on aggression, how strong are you, how physically trained are you, etc., etc. So it's not that everybody is fit to do this work.
Training, maybe have
The institution is training. Yes. So what we do, de-escalating training is just a basic training. But when you work in such an institution, you get a training to develop your physical skills. To what do you do when you have, so for example, an aggressive patient, and with your colleagues you want to take him down, like that, or to you want to take him to the bring him to the separation room. So that kind of skills are in a training in every institution, which is obligated to do.
Yeah. Okay.
Yeah.
And but one addition, I think, because you said you have to be maybe a little bit bigger.
Yes, because because the patient maybe have a bigger body.
You think that that could be helpful, and of course it is helpful, but don't underestimate the small and tiny people, because in the end, it doesn't matter how you look like, it depends on your skills, and the
Oh,
skills
yeah.
are most of the times in communicating, like, and also feeling the tension of the patient and reacting on the tension and reacting on the stress, and you don't need to be big for that.
Oh yeah.
You just need that forensic,
Feel.
view and the sensibility to, the sensibility to see the signals that already come in the first phase of before someone is getting really aggressive. So you don't really need to be big.
Okay.
It's helpful, but
Yeah. Oke. Oke, ada lagi pertanyaan? Ya. Oke, monggo Bapak Ibu, ada yang punya pertanyaan terkait dengan forensic nursing, psychiatric nursing ya. Boleh di chat di boxnya atau mungkin raise hand. Raise hand, monggo. Bapak Ibu yang dari clinical preceptor. Ini menarik ya topiknya ya, terkait dengan forensic psychiatric nursing. Kita lihat juga tadi ya institusinya. Oke, mungkin ada lagi. Oh, ada. Oh, Pak Syahrul. Ya, oke. Mr. Syahrul have a question, please.
Okay, thank you for the presentation. So yeah, this but new knowledge for me. Actually, my background is not from psychiatry. So yeah, I agree that after your presentation, Bu Santi give feedback how's the condition our country and then concern for the criminal and mental health. Yeah, because I'm as a nurse, but I'm not really contact with the psychiatric atmosphere in somewhere. So the first thing that I think before, like what Santi said, every single criminal in Indonesia is like connected to the mental health. Is it true? The mental health from the criminal, or we just pretend to be a mental health? I think all of the criminal or the extreme criminal always see from this side. Is the really mental health or the pretend to be a mental health? Even for the, maybe I would say the like a political criminal or the corrupt, you will see there is a mental health or no. It's like, yeah. I mean, for any single criminal, you will see from the mental, is it true or not? That's why when the first thing that you start, I just thinking about it, because just say like a murder, just case murder, and then you will see it is a mental health or like the murder have intention to kill, or just mental health. I think every single criminal will see about it. So my question is, how about in your institution? I mean, because you have already system and also the institution focus on the criminal mental health. Is it the same with like our system that every single criminal will see from the mental health? Is it true or not? Is in the mental health? But just if the criminal or pretend to be a mental health, but actually I really want intention to kill the victims. Okay. And then the second one, when you when we see your video, I just back to the movies that I watch also. Yeah, because yeah, same like Abu Santi said, like yeah, that's why I asked you, is the jail, hospital, or institution? Because the buildings make me bring me back to the movie that I watched. Yeah. So like you said, in my immediate imagination, it's like a criminal mental health. It's like, I'm sorry, not like jail, because like drugs we can distribute anywhere and something like that. And if you see from the, of course, from the American Europe movies, you'll see that the jail is like there is a big gangster or drugs can distribute anywhere, and they can pay the police something like that. And then I just want to ask about how about in here, yeah, but like this is like really movie. So there is the gangster, and there is police, and there is the head of policeman something, and they are cooperating something. So also about the challenges also with the system, and then maybe related with the first question, maybe there is the leader of the criminal just to be pretend to be a mental health, but they're doing their business. And this brings me to like a movie, but maybe it's true or not, because yeah, maybe it's coming from the true story and yeah. Okay, thank you.
Thank you. Two nice questions.
Yeah, the next.
To answer your first question, like there are a lot of people who pretend to have a mental illness, and they use that as an excuse for the crime they committed. I think that our psychiatrists have enough skills to see through that kind of attitude, to really make a good examination of and maybe a longer lasting examination of the patients, so they can come to a real good conclusion. So but that demands a lot of observations. Patients are examined in a special center, the Peter Baan Center, we call it, and there they stay for a longer time, and that's where the psychiatrist makes his report and comes to the conclusion: is there really a mental health issue or not? So yeah, the other way, the other way around is also an issue, because people who pretend to be mentally healthy really do have a serious mental health problem. Yeah. But in fact, I think that in every case of murder or multi-murder or whatever, we could say that someone has a mental health issue. Yeah. And your second question was about the institutions. Well, you know, well, for example, drugs are taken into the institutions by the visitors, and we don't. Well, we have some ideas of how they get to that point, and how they take it in, but it's not always visible. It's not always clear how they take it in. Yes, that's a problem. That's a big problem. So there's a lot of smuggling drugs or selling drugs from patient to other patients. That's that's like in jail, in fact. Yeah. I remember when I worked in a jail in Zwolle, and when there was a visiting hour, they came to a point that prisoners were forbidden to kiss each other, because by kissing they could so like this kind of thing. And that's the same in this institution. So it has some similarities with the policy in the jail, or with the incidents in the jail. That's right. On the other hand, as you can see, it shows more a normal environment with sport and with work, etc. Than a jail, than a real jail. The gates are not as high in a jail. So, okay. Corruption. Well, I think that the system in Netherlands is not corrupt, but accidentally it happens that a guard is corrupt. Yeah, that is, but it's very incidental. Yes. I don't know if it all gets into the public opinion. I don't know. So maybe things are a little.
Clear. Okay. Yeah. Have a high curiosity. It's okay, Mr. Saru. No question then.
Question is about
Nggak ada.
when they
Jadi tak tanya aja dari.
like I'm not sure if you are not in practical classes. If they are finished from the rehabilitation, so will they come to the environment? Because as I know that really there's many problem about it when they are coming to an stigma, bullying, something else, and then I guess that for the criminal, it's like add more burden for them. Just tell them I want to be a good person now. Yeah. But the stigma and everything else, because I think it's higher burden than just like a normal mental health. Because they can make, especially maybe in our countries, with the society behavior environment is really concerned about it. Is it true you will be a good person after time like that? But it's not only a mental health, they're not criminal. How's about it about this issue, and then also of course our role as the nurse also to mention that when they come back as person, humans, their employment, so they can do like humans to be not able or the cleaning now. Of course, I guess that not all the they come in the institution or in the hospital, but they can make also to the environment. Yes.
The last question, I want to add a question. How long normally the average of stay?
Yeah, length of stay for the patient. Aku juga pengen tanya itu tadi. Yes,
Maybe I can answer your question because my husband is a social worker and he works in the outpatient phase. So he works with patients for the forensic care who are now trying to live independently again in community, and they get transmural care. And of course, these people they are very aware of the fact that they sometimes are even famous because they were famous because they, for example, murdered someone or did some criminal delete that was very in media as well. So they are very aware of the fact that people remember them and that they will have a reputation. So in order to make sure that these patients can deal with that, they have a lot of therapy on that. So they talk about it, they have reflections on that. They try to simulate situations in which when the patients are outside or in the end living independently, what can happen and what can they do. So they simulate these kind of situations in order to make sure that they will deal with it. They learn how to deal with it and they learn how to accept the fact that people will still think sometimes that they are the criminal they were before, although they are already 20 years in treatment, for example. So yeah, and that's actually kind of difficult, of course, because we cannot change the thoughts of someone else, you know. The only thing what we can do is treat or help these patients to deal with this difficulties. So that's what the nurses and also social workers are trying to work on in this outpatient phase and also in closing phase. So before patients really start living independently in the community again, they practice a lot of this kind of situations. And the second question was about how long, on average, people stay in this this kind of treatment or in this forensic care. Of course, it depends on the crime, because you cannot get this kind of treatment if you did something where you are punished with a treatment less than 4 years of jail. So it has to, this kind of treatment is always for people who committed a crime where you get at least 4 years of jail for. So these are not the normal robberies, you know, these are really, yes, these are really, yeah, the higher level of criminal offenses, I think. So, and patients always start first with the prison. So sometimes, for example, one example, my husband is working together with someone who he was in prison for 20 years because he committed a double crime, double murder. 20 years in jail, and then afterwards he got 8 years of treatment, and now he is in the outpatient phase, so independently living already for 2 years with transferable care. So you can imagine it's 38 years before start living all alone independently as before. And but of course in his caseload there are also young boys who, for example, did armed robbery, used a lot of violence in order to get money or get other things. They probably have went to jail for around 8 years, maybe, or 6 to 8 years probably, and then they have a treatment less than 2 years, for example, and starts dealing with it. So it really depends on the criminal offense, I think, but it can take years, and also it can be because these treatments, the judge always starts with 2 years. And then it will be if the patient is not doing well yet or not realizing his behavior has to be changed, it will be extended with another 2 years, and then again another 2 years, and again another 2 years if it's not changing. Sometimes after 2 years the treatment can be done and go to the outside full phase, and sometimes they're extending it every time and every time again. Yeah.
Okay, clear.
Like in Shawshank Redemption. Remember the movie?
Yeah, in the movie, yeah.
Extended and extended.
Extended, yeah. Okay, it is clear answer, yeah. Bu Santi, Pak Syahrul. Okay, udah akhirnya. Okay, I just have one question about the socialization for your students to have a career in the forensic institution. Maybe you said already mentioned that there is the challenges to make them wanna or have a willingness to be a nurse in there.
Yeah.
Maybe you can just share about your experience just briefly, or maybe you give many benefits that you want to work in there, like have a salary, or maybe have a high credential promotion after, something like that. Maybe just simple answer.
well, I always say to students, when you work in a hospital, medical hospital, you get a lot of rewards, compliments from people. They're very grateful to you. Don't expect that in this kind of
Yes, yes, yes.
institution. No, the only thing you hear, well, besides those incidentally compliments, but most times it is invitation, admission, etc. You know. So
Yeah, yeah, like you. Yeah.
build it up.
Okay.
Why should you do this? Because the getting in contact with these people and then trying to understand how they came to this offense and the history of the people. The thing they most time they had bad news. They had, for example, addicted parents. They had they were how do you say that? Bullied. They went to from like the consciousness has not been developed well, so they miss the antenna for doing good things, feeling what is good, what is right, what is wrong, and to help these people little step forward in their development is a great challenge in their
Yeah, definitely human right.
Yeah.
Yeah.
So also gives a lot of satisfaction, I think, when you can make really small steps with a patient.
Yeah.
If there's one day and someone was able to, for example, speak about his feelings in a right way, you can feel really satisfied with that. You know, so small steps and things that could be normal for us, but for them very difficult and also very challenging. So I think these small steps are the ones that where you want to do this for. Really.
You know, there's a lot of humor as well.
You need it.
You need it among patients as well. You can imagine. Once was speaking to a patient who was in front of me, and suddenly he said, "You get the regards from my voices." Okay, so, that's great.
Yeah.
It was
Like
from schizophrenia. So when I left the building, and I waved at him, and he said, he said to me, "Well, you're in my head now too, as a voice." I said, "I hope in a positive way." Yes, in a positive way. So that kind of great things that happen.
yeah.
It's very dynamic. There's I think, and really among the nurses, there's a great sense of humor, because you have to deal with, you have to get rid of your stress. So I think the atmosphere is very dynamic.
Yeah, very
Relaxing, talking, open with each other about what you experiences are that day. Just be open to each other. What do you think is difficult? Where do you need support from another colleague?
Yeah.
Is it okay that you're going to visit a patient on your own?
Yeah.
Or do you want that sometimes going with you?
Yeah.
So that's really, so it can be at a level of I'm going to give someone coffee, but is it can I rely on him not throwing the coffee on my face, the hot coffee? So that kind of things you have to be very alert.
And
Maybe one more thing, I think.
okay.
Working in a hospital, you use protocols. You know, if this is the problem, then I do this intervention, and this intervention is in the protocol, and you just do it, and then you did it. It's okay. But for this kind of care, you do have protocols, of course, and things like that. But you must rely mostly on your intuition.
Yeah, use
Use your intuition and use use your common sense to decide what you're going to do and how you're going to react. Sometimes you have the feeling you need to leave someone a little bit, leave the patient a little bit, and sometimes you have the feeling I really have to be aside the patient now, and you all do this. You do this purely on your intuition, I think, and this makes it really challenging because then you have to trust you have to trust on your intuition, but also this makes it very beautiful, I think.
Okay, yeah.
Ambassadors for forensic care, I think.
Okay, thank you so much for Sunny and Helen, and the other participants. Okay, now just make a simple brief summary that forensic nursing, especially forensic psychiatric nursing, is very important, and the nurses have a vital role to give to assure the safety for the patient and only for and also for the nurses, and nurses have improve their communication skills to to taking care of the patient, and using intuition her or his intuition when taking care of the patient. And this is very new for us. We hope that many benefits will getting from you, from all of you to us, and we hope that in Indonesia we have a forensic mental health institution, seems like in Netherlands, because like already mentioned from Miss Santi, there are many problems that's related to criminal and then needs to taking care or treatment in the forensic institution. I think enough. Terima kasih Bapak Ibu semuanya atas kehadirannya. Kita sekarang berada di acara penutup. Mohon maaf, ini tadi ternyata ada gangguan technical system ya, maksudnya untuk dari suaranya. Semoga tetap ada yang nyantol gitu ya. Tadi ada beberapa yang gagal paham, semoga ada manfaat yang bisa didapatkan dari slide yang sudah dipresentasikan oleh Hyllan dan Sani. Dari saya mohon maaf apabila selama membersamai menjadi moderator ada hal yang kurang berkenan. Okay, now we will closing our scientific forum with saying hamdalah together. Alhamdulillahirabbil alamin. Okay, thank you so much, Sunny and Hyllan, for your nice and informative presentation, and also you share experience about it. And we know many things, Mr. Sahru and Miss Santi very curious about it, and me also, and all of the participants. Okay, now we have a closing statement, and from me, okay, give applause for us. Okay, from me, wassalamualaikum warahmatullahi wabarakatuh. Terima kasih. Thank you for your attention. Kind attention. Okay. Oke, terima kasih Bapak Ibu.